Well, before I entered recovery, my life, well, it was more than 30 years that I was an addict and an alcoholic. And I had a really hard time finding a rehab program. I went to NA and AA and I was looking for counseling, and it was really hard to find someone who matched my needs as a deaf individual who uses American Sign Language. And I was socializing with hearing people, trying to get recovery, and it was very, very frustrating. Communication didn't work. And when I found the Deaf Off Drugs and Alcohol program, I had communication. I could start thinking about my recovery, and that was a really big help.
The goal of this short video is an attempt to bridge the gap between education and training, research, and clinical practice. This will be illustrated to you by presenting three different entities. One called CAM, which is a Consumer Advocacy Model. It's a clinic located in Dayton, Ohio. The other is a SARDI, and SARDI is located in the School of Medicine at Wright State University, as well as the College of Education and Human Services at Wright State. The clinicians at CAM and the researchers at SARDI, as well as the educators at Wright State University, have really a special relationship and working together and collaborating and providing opportunities for students to work within these settings. You know, the ultimate goal is really to better the lives of people with disabilities, and we do that through this collaboration.
SARDI is the research component of this collaboration. SARDI stands for Substance Abuse Resources and Disability Issues. It was started in 1990 as a 2-year federally funded grant to specifically look at substance abuse in people with disabilities. One of the exciting things about this research is that at first no one thought that this was needed. People thought that folks with disabilities maybe didn't use alcohol or other drugs. We did find that they do, and that prevention and other efforts are needed. SARDI continues to do research, we continue to develop and evaluate programs, and we continue to disseminate the findings from this research to rehabilitation professionals across the country. Our primary goal is to improve the lives of people with disabilities, especially those who experience behavioral health issues such as substance abuse.
The Consumer Advocacy Model was founded in 1991 from a grant-funded project. Since that time, we've expanded our services to include those with substance use disorder, mental health illness, as well as those experiencing physical and cognitive issues. We value our connection with SARDI as well as Wright State University, and the students ultimately are the ones that benefit from this collaboration.
So the educational piece of this three-way collaboration is housed at Wright State University, College of Education and Human Services. And within Human Services, we have a master's program in rehabilitation counseling, and there's a focus on either severe disabilities or chemical dependency. I'm the program director for the chemical dependency part. Within that program, students have the opportunity to get a special education in chemical dependency and working with people who have addiction issues. They have the potential to do their internship at CAM and other facilities like CAM, as well as some research opportunities at SARDI. Finally, our program is unique because it's totally online. So we can have students located in different geographic regions, which helps serve students who may live far away and who also may have disabilities that makes it hard for them to travel.
As a student here at Wright State, I became familiar with the Step Up program, which is a program through SARDI that educates the students here at Wright State and other universities on HIV, STD, drug and alcohol abuse awareness. And after volunteering with them for a few years and actually becoming a full-time employee, I've learned how research plays a big part in the work that we do. And when you see that, you just fall in love with it. You love doing something for the common good.
So some of the awesome things about our collaboration with Public Health Dayton Montgomery County is the fact that we've been able to serve well over 8,000 consumers through HIV testing and Hep C screens. We also have 5 minority projects, which are Sister Line, ROSC, Healthy Brothers, Healthy Sisters, and 50 Plus, that go out into the community, go out on site. We're actually at a site right now where we're providing intervention, testing, and education. We also have a satellite office right in the heart of West Dayton, which is our Mount Olive One-Stop Center, where we provide food pantry, clothing pantry, lunches, HIV testing, Hep C screens there as well. And we have 12-step meetings. So these are things that our federal funds provide us in order to gain research and hopefully more funding to get the services out to the marginalized populations that we really need to serve.
Today, SARDI continues to conduct research in a variety of new areas. One area of interest is social media. Another is utilizing technology to improve some of the services that were currently offered. In our history, we have changed with the times. SARDI is always looking to be on the forefront of some of the new information and new technology and new research that is out there. This allows us to enhance the types of services that we offer and to provide services to some people with disabilities that they might never have had access to otherwise.
The benefits of using technology-assisted care for people who have disabilities and or for people who have co-occurring disabilities or SUD disorders are that it provides an arena of access for folks who might not normally be able to get to a treatment facility or might not be able to be served in a traditional setting.
Well, I've talked about myself and thinking about all the different experiences, all the towns I've been in, and the struggles I've had in my life. I wanted to be sober. I wanted to be in recovery, but it was such a struggle until I came to Dayton and I had hit that wall. And at that point in my life, I was ready for a change. And to have a program that was specialized for me helped me succeed. I have a job. I have a better life now.
Bridging the gap between education and training and research and clinical practice takes a lot of effort, but it's worth it. It's worth it to those who have disabilities. It's worth it to the students who get to see research and clinical practice interplay with each other and interrelate, and it's worth it to the staff and clinicians and researchers in these three entities. Most of us go home with a satisfaction at the end of the day knowing that we're trying to better the lives of people with disabilities.